The question has been put to us on what is contact tracing and what it involves. People should realize that contact tracing has been around for a while. There are a number of reportable diseases that we have to investigate, and some of those diseases are transmissible. So whenever we find out that an individual may be positive for COVID-19, we reach out to that individual, and that is through usually a phone call. And during that phone call, what we go over are things like symptoms. We educate individuals on the proper precautions that they can take to not only to ensure that they remain healthy, but also those in the household and other contacts. When you see the phone ring, obviously you want to ascertain who's calling you. I would advise that you pick up the phone, and if it's someone from our department, they would identify themselves, state their credentials, and explain the reason why they're being called. The same way, again, sometimes the state may be involved in contact tracing, so the phone number that you receive a call from may be a 518 phone number. And so I would advise that, again, if you are a case or a contact, that when you get this call, that you take it. Some of the information that the caller may be asking during the contact tracing process is obviously, your symptomatology, whether you're symptomatic, your test results, where you got tested, when you got tested. The other things that they will ask about is places you've been, people that you've seen, and the timeline, meaning when things occurred. And so those are the basic pieces of information that are involved in the contact investigation. Sometimes the contact tracing process takes a little time in terms of getting all the information, getting all the numbers. And so it may be days before someone is reached. And so it's important that if you know your status, meaning if you've been told by a physician, or if you received a test result because you went to a site and got tested, and if you know that you're positive, while you are waiting for the contact tracers to contact you or the case investigators to call you, that you reach out to your contacts, the people that you've been around when you were symptomatic or the several days before you were positive, and let them know that you were positive, and to counsel them and to educate them and to making sure that they start quarantining. This is how you could help the public health fight.